So the drugs which can be given in case of iron toxicity or poisoning is, you have desferrioxime. So this is given by intramuscular route. Whereas there are other drugs which can be given through oral route. They are deferriprone and deferrasirox. So these two drugs are given through oral route in case of the iron poisoning. So what about in case of the copper poisoning? In case of copper poisoning, you will be using the D-penicillamine. So you will be giving the D-penicillamine, which chelates the copper. So what about in case of lead poisoning? In case of lead poisoning, you are going to give a British anti-levisite, or you are going to give the EDTA. So what about in case of organophosphate compound poisoning, or in case of the carbamate poisoning? So the drug of choice in case here is the atropine. Atropine is the drug of choice in case of OP compound poisoning. So what about in case of the poisoning or overdose due to atropine? In case of atropine poisoning, the antidote will be your physostigmine. So you may be wondering what happens if there is a overdose of this. So in case of overdose of physostigmine, then the antidote will be your atropine. It is vice versa, atropine. So what about the toxicity due to beta blockers? Here the antidote will be your glucagon will be the antidote. What about the antidote for benzodiazepine overdose or benzodiazepine poisoning? So here the antidote is flumazanil. Flumazanil is an antidote for the benzodiazepine overdose. What about the digoxin? So in case of digoxin toxicity, you can use digibind. You'll use the digibind. So digibind is the antidote for the digoxin overdose. What about in case of the opioid toxicity or morphine overdose? Here the drug of choice will be your opioid antagonist, that is naloxone. Naloxone is the antidote for the morphine toxicity. So next, moving on to the other group of drugs like paracetamol. What happens in case of paracetamol? So you need to give a antidote. Which is the antidote here? It is your N-acetylcysteine. So which is the minor metabolite which is responsible for toxicity? It is your N-acetyl para-amino benzoquinine amine. N-acetyl para-amino benzoquinine amine. So antidote for paracetamol poisoning is N-acetylcysteine. So what about in case of the acidic drug poisoning? So there are some acidic drug poisoning, like it can be caused by weak acidic drugs like aspirin, barbiturates, chlorpropamide, triimipramine and imipramine. So in case of acidic drug poisoning, what you need to do is you need to go for forced opposite, that is forced alkaline diuresis. So how we can do the forced alkaline diuresis? By two things: by administration of the sodium bicarbonate, or you can go with the carbonic anhydrase inhibitors like acetazolamide. Okay, so what is the antidote or measures that will be taken to reduce the basic drug poisoning? So basic drug poisoning, usually the example are quinine, amphetamine, atropine. Usually the weak basic drugs will end with the INE. So in case of weak basic drug poisoning, you need to go for forced acidic diuresis. So how you can do the forced acidic diuresis? So the example is, you should give a ammonium chloride or you can go with the any citric acid, that is vitamin C, or you can go with the ascorbic acid or ascorbic acid for acidification, urinary acidification. So which is the antidote for heparin overdose? So heparin overdose, you need to go for protamine sulfate. So please remember, the antidote is protamine sulfate. So which is the antidote for warfarin overdose? So warfarin overdose, the antidote will be your vitamin K1, or you can go for fresh frozen plasma. So which is the antidote for apexaban? Apexaban, which is a factor 10 inhibitor. So it is, the antidote for apexaban is anti-XNET alpha. How you can remember? You have a exa here, and also here you have exa, that is ban. So you are banning the 10A. It bans the 10A factor. So the antidote will be the anti-XNET alpha. What about the dabigatran, which is a direct thrombin inhibitor? It is given through orally. So here the example is idarucizumab. It is here idarucizumab. How you can remember? Dabigatran, daru. You can remember it as darucizumab. So it is given through injection. What about the streptokinase? Streptokinase, the antidote will be your epsilon amino caproic acid, or you can go for tranexamic acid. So next, moving on to the other toxicities like cisplatin. So cisplatin will going to cause mainly the ototoxicity as well as the nephrotoxicity. So this can be reduced by ototoxicity and nephrotoxicity. So this can be reduced by giving amifestin, and also by increasing the hydration. So there are some drugs you should be very careful, because along with cisplatin you should not give other drugs like loop diuretics, and also you should not give aminoglycosides. So how you can remember? You can remember it as CAL, that is CAL. So you should not give CAL. Cisplatin, aminoglycosides and loop diuretics they are known to cause the toxicity like nephrotoxicity and ototoxicity. So what about the bleomycin? Bleomycin are known to cause pulmonary fibrosis. They are known to cause pulmonary fibrosis. The antidote will be your perfenidone. So this is known to cause the pulmonary fibrosis. So what about the cyclophosphamide? Cyclophosphamide are known to cause a hemorrhagic cystitis. So there will be bleeding, hemorrhagic cystitis. So which is the antidote here? Antidote given is the mesna. What about the doxorubicin? So doxorubicin is a cardiotoxic drug. It is a cardiotoxic drug. Doxorubicin, please remember, it is a cardiotoxic drug. So in case of the doxorubicin, which is the antidote? So please remember, the antidote will be your dexrazoxane, which is a iron chelator. So please remember, the antidote for doxorubicin is the dexrazoxane. So how we can remember? Doxorubicin, dexa. So cyanotoxicity, how we can treat the cyanotoxicity? By giving the hydroxycobalamin. So these are some of the drugs and their toxicity, as well as the specific antidotes and some measures to reduce the drug toxicity. So hope This will be helpful for you to pick the right answer with respect to the drug toxicity as well as the specific antidote. Please remember, again, please revise these tables. 100% there will be one question related to the drug toxicity in every exams. Thank you.